Hi, I'm Sarah, and welcome to my channel, The Spoony Life and Beyond. Just letting you know that I am not a doctor or a medical practitioner, so anything that I say today is not intended as medical advice. It is for awareness purposes only. I am actually vision impaired, so I most likely will not be looking at the camera, and I do apologise. Today's discussion is going to be raising awareness about rheumatoid arthritis. So let's do a deep dive on rheumatoid arthritis. So, rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. Um, it is an autoimmune disorder. So, rheumatoid arthritis occurs when your immune system mistakenly attacks your own body tissues. So, you can find a lot more information as well doing research via the Mayo Clinic or the Cleveland Clinic. So, there is a lot of information about, sorry, I do apologize, about rheumatoid arthritis. So, unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, so causing a painful swelling that can eventually result in bone erosion and joint deformity. So the inflammation associated with rheumatoid arthritis is what can damage other parts of the body as well. So while new types of medication have improved treatment options dramatically, severe rheumatoid arthritis can still cause physical disabilities. So signs and symptoms of rheumatoid arthritis may include tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and loss of appetite. Early rheumatoid arthritis tends to affect your smaller joints first. So, particularly the joints that attach your fingers and to your hands and your toes to your feet. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders, so the larger joints. And in most cases, symptoms occur in the same joints on both sides of the body, sorry. So about 40% of people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. So areas that may be infected could be the skin, the eyes, the lungs, heart, kidney, even the salivary glands, nerve tissue, bone marrow, blood vessels. So, rheumatoid arthritis signs and symptoms may vary in severity and may even come and go. So, periods of increased disease activity, also known as flares or flare ups, alternate with periods of relative remission. So, when the swelling and pain fade or disappear. So, over time, rheumatoid arthritis can cause joints to deform or shift out of place. So, they generally advise that to see a doctor if it becomes persistently discomfortable and you start to get increased swelling in your joints. Rheumatoid, sorry, I do apologize. I do text to voice due to my vision loss. Sometimes I get a little bit lost. So rheumatoid arthritis is an autoimmune disease. So normally your immune system, helps protect your body from infections, disease, toxins. But in rheumatoid arthritis, your immune system attacks the healthy tissues in your joints. So it can also cause medical problems with, as previously mentioned, heart, lungs, nerves, eyes, and skin. So doctors don't know what starts this process, although a genetic component appears likely. While your genes don't actually cause rheumatoid arthritis, they can make you more likely to react to environmental factors such as infection with certain viruses and bacteria that may trigger the disease. So, some of the risk factors of rheumatoid arthritis are your sex. So, women are more likely than men to develop rheumatoid arthritis. So, there's also age. So, rheumatoid arthritis can occur at any age, but it most commonly begins in middle age. So, there's also family history. So, if a family member of your family has rheumatoid arthritis, you may have an increased risk of the disease. So, smoking cigarettes increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. So, if you weren't a smoker when you started with rheumatoid arthritis and you then became a smoker, then the severity of the disease can really pick up and your flare ups could be a lot more severe. And you could end up with more involvement with other organs or systems. So, also excess weight. So, people who are overweight appear to be at a somewhat higher risk of developing rheumatoid arthritis. So, there are things or complications that you're more at risk of if you have rheumatoid arthritis, and that's osteoporosis. So, rheumatoid arthritis itself, along with some of the medications used for treating rheumatoid arthritis, can increase your risk of osteoporosis, which is a condition that weakens your bones and makes them more prone to fractures. Even with a slight fall or stepping on a stone. I have osteoporosis. I stepped on something the wrong way and I fractured the middle of my heel. I had a slight fall once and my knee bent the wrong way and I fractured the bone just under my knee. And so it does make it very easy to get fractures. So also there is rheumatoid nodules. So these firm bumps of tissue most commonly form around pressure points such as elbows. However, these nodules form anywhere in the body, including the heart and lungs. So dry eyes and mouth as well. So people who have rheumatoid arthritis are much more likely to develop Sjogren's syndrome, which is a disorder that decreases the amount of moisture in the eyes and mouth. There's also an increased risk of infections. So with rheumatoid arthritis itself and many of the medications used to combat it can impair the immune system, leading to increased infections. So you really need to protect yourself with vaccinations to prevent diseases such as influenza, pneumonia, shingles, and COVID. There's also the abnormal body composition. So the proportion of fat to lean mass is often higher in people who have rheumatoid arthritis. So even in those who have a normal body mass index, also known as BMI. So carpal tunnel syndrome. If rheumatoid arthritis affects your wrists, the inflammation can compress the nerve that serves most of your hand and fingers. Then there's also heart problems as well. So rheumatoid arthritis can increase your risk of hardened and blocked arteries, as well as inflammation of the sac that encloses your heart. Lung disease. So people with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissue, which can lead to progressive shortness of breath. And unfortunately, there is a lymphoma. So rheumatoid arthritis increases the risk of lymphoma, which is a group of blood cancers that develop in the lymph system. So, unfortunately, there is a wide variety and severity of issues that can arise from having rheumatoid arthritis. So, I do apologize for the pauses. I myself am actually having a flare up because I had my immunoglobulin infusion at the hospital a couple of days ago, and unfortunately, I had a reaction. Um, so, there is that wide severity of rheumatoid arthritis. And I actually spoke to somebody who I know who has rheumatoid arthritis and gets it quite severely as well. And I did ask them some questions, and they did say to me that they have to quite often get up at work and stand up and move around because they do have those issues where if they if they do sit for too long, as I stated before, that the pain can be worse after being inactive for a period of time. So he has to make sure that every so often he actually gets up, walks around, has a break, and then sits down again. But also has to be aware of his posture, and making sure that he is taking the right care for his joints, and keeping an eye out for anything new that may come up. But has also personally chosen not to take medication for it because it does uh, make you more increased for infections, more chance of infection. And with his child who goes to school and quite often gets sick from going to school, he doesn't want to have the risk of being sick all the time from taking immune suppressants to help treat the rheumatoid arthritis. So so he has taken other alternative ways of trying to treat it. Like I said, just being mindful of getting up and moving around, trying to look after the joints, eating healthy, knowing what he can and can't eat and what affects his joints, which has taken a long period of time. And like most autoimmune diseases, it does take time to learn how it affects you and how it causes your triggers, what triggers it. It could, you could, in some diseases, it could be as simple as having a bit of lemon. Like in Behçet's disease, having some lemon can actually trigger a flare. So it is quite difficult with rheumatoid arthritis. It is a well-known name within the autoimmune or chronic illness or Spoony circle, but not a lot of it is known more than it's just a type of arthritis in the joints. There isn't a lot of that awareness that it does actually affect your internal organs. It can affect, multiple systems in multiple ways and can actually cause cancers, blood cancers. So there is, that need for raising that awareness. So I think it's good if we can all learn, and spread that awareness, and hopefully then it will help people in the community who have rheumatoid arthritis, to not feel as if that they're misunderstood, because a lot of the times, unfortunately, with cases like this, because it's an invisible illness, there is that stigma that, oh, it's just a bit of arthritis, it's rheumatoid arthritis, oh, they just get sore joints, they'll be fine. And it's not that simple. Rheumatoid arthritis is actually quite serious, and should be taken seriously. So I really think that within the community and outside of the community, there really needs to be that awareness, along with the other deep dives that I do, trying to raise awareness within the community so people are aware of invisible disabilities, and trying to reduce that stigma that goes along with invisible disabilities that unfortunately a lot of us go through on a regular basis. So I really like to thank you for joining me today on my live. I will be doing another one coming up shortly. I will be doing another deep dive. The next deep dive that I will be doing will actually be on Behçet's disease. So I hope that you can come along and join. I am also looking for guest speakers. So anyone within the chronic illness, disability invisible disability community, even supporters, loved ones. Um, I am looking for guest speakers, so because I do have a couple coming up, but then I would really like to have some more so we can learn people's journeys more and get to uh, you know spread that awareness from other people's point of views as what it's like to be within the community. So I'd really like for you to reach out and let me know if you'd like to be a guest speaker, because I'd love to have a chat to you. So send me a private message and then we can have a chat. And I shall see you in my next deep dive, which will be on Monday, and that will be on Behçet's disease. So thank you for joining me, and I shall see you in the next video. So please like, share, and follow, or subscribe. See ya. Bye.